Okay, everyone, the live stream is active and it's on about a 20-second delay.
Okay, thank you.
All right, with that, if we want to go ahead and get started with introductions, and I'll just call you out based on how you're showing on my screen. I think most of us know each other, but it looks like Lacey is new. So I can start. My name is Nate Camban. I'm the superintendent for the Tuscarawas County Board of DD. Veronica, do you want to go next?
Sure, I'm Veronica Spida. I'm the manager of community services for the Adams Board.
Awesome. Sue?
Wait, you're muted, Sue. Hold on. Let me unmute you if I can. Sue.
I did it. Thank you. I'm Sue Shackelford from Harkness Head Start, Disabilities Prevention and Mental Health Manager.
Thank you, Sue. Next, Michelle.
Hi, I'm Michelle Sayer, the fiscal manager of the Adams Board.
Thank you, Michelle. Next, I see Robin.
Robin Waltz with United Way.
Awesome. Good morning, Robin. Danielle.
Danielle Lurie with the Adams Board. I am the operations manager there.
Danielle. Mandy.
I am Mandy Prosser, the executive director from Noah's Hope Child Advocacy Center.
Thanks, Mandy. Next, I see Jen Flaherty.
Hi, I'm Jennifer Flaherty, and I'm a parent.
Good morning, Jen. Next, David Brand.
Hi, guys. I'm Dave Brand with Superintendent New Philadelphia City Schools.
Thank you, Dave. Paige Robeson.
Paige Robeson, service coordinator from Family and Children First Council.
Awesome. Paige. Natalie Bolin.
Natalie Bolin with the Adams Board.
Thanks, Natalie. And then Lacey, if you'd like to introduce yourself.
Yeah, sure. I'm Lacey McCain, and I am the new executive administrative assistant in the mayor's office for the city of New Philadelphia. I am taking Marianne Audie's spot here.
Awesome. Well, welcome, Lacey. It's great to have you here.
Thank you.
Well, with that, if we go ahead and get started, I don't see any other guests here this morning. If we want to take a motion to approve the agenda for today.
So moved.
Right. Natalie, second.
Second.
Thanks, David. You guys would like to take a chance to review that, or are there any discussion? If not, all in favor of approving the agenda as presented, say aye.
Aye.
Right. Any opposed? Abstentions? Looks like the motion carries. All right, next we have the approval of the meeting minutes from our June 11th, 2020 meetings. Those are in pages 2 through 7 in the board packet that Veronica sent out. If I can get a motion in a second, then we can discuss and vote.
I'll make the motion.
Thanks, Robin. Second?
I'll second it. It's Mandy.
Mandy? I want to take a second and look over those. Do you have any questions or discussion? If not, all in favor signify by saying aye or raising your hand.
Aye.
Any opposed or abstentions? Okay, motion carries. Next, new member introduction. We've already done that. Again, welcome, Lacey. Item 2, Budget Committee. List of bills are from July 2020 are on page 8. If I can get a motion in a second, then we can discuss.
I'll make that motion.
Thanks,
I'll
Natalie.
second.
Second, Robin. Right, Danielle, Michelle, either of you guys want to give us any updates on this?
I think Danielle has designated me today. On the list of bills for July, there's only 2 things that I wanted to bring to your attention. The first one is the very first bill for health insurance, the Tuscarawas County Healthcare or Alt Care Cobra. That is the final payment we're making for the health insurance for Josh Jones. So there won't be any additional payments made for health insurance at this point. The next one is right at the bottom of that little list of L50. That is the building capacity grant. That was a one-time opportunity for councils to apply for some additional funding. And we spent it on masks, face masks through Roberts. We have quite a few of them, and I know Veronica is going to be working on getting them distributed. We also are expecting some thermometers, but that's about it. So I've indicated on here which expenses are coming out of fiscal year 20 and which expenses are coming out of fiscal year 21. And Lacey, for your information, we operate on a state fiscal year that goes July to June. So some of these expenses occurred prior to July and some of these expenses are after July. So the asterisk indicates which are which.
Okay.
Fiscal years are confusing. So that's all I have for that one.
Okay, great. Any questions from the group? Not, we can move to vote. All in favor signify by saying aye or raising your hand. Anyone opposed or abstaining? All right, if not, it looks like the motion carries. Next, we have a list of bills from August 2020 on page 9. If I can get a motion in a second, then we can discuss.
So moved.
Thanks, Dave. Second. Sue, thank you. Right, Michelle, I'll turn it over to you.
Okay. This is pretty much the same layout as the previous month. There's nothing really unusual on this list of bills, but you can see that there are more expenses that were occurred in fiscal year 21 by the asterisks to the left of the vendor. So if anybody has any questions, I can elaborate. I know this is exciting stuff.
All right, if not, I'll take a vote. All in favor signify by saying aye or raising your hand. All right, looks like the motion carries. Are there any abstentions or opposition? No? All right, motion carries. It looks like next, item C, financial statements as of June 30, 2020, pages 10 and 11. Can I get a motion?
So moved.
Thanks, Dave. A second, please.
I'll second.
Robin? All right, Michelle, turn it over to you again.
Okay, on the balance sheet, it's just pretty much a shot of where we are currently. This is only going through June 30th. We have not opened the financials yet for fiscal year 21. So once this is finalized, you will also be receiving the fiscal year 21 financials, recapping everything from July 1st through current time. So I don't know if anybody has any questions on that, but I can move on to the revenue and expense report if you don't. Okay, moving on. On the revenue and expense, you'll see that we do have some funds that haven't come in their entirety yet. The MSY building capacity grant money, the $6,750, that will be coming. That's in the works, so it's not as if that will be a deficit. Also, the FCSS federal, that's coming as well. We did receive $11,575, and we will be receiving the balance probably next month. We were actually able to request additional money for FCSS because we did have extra expenditures that could apply to that funding. So we received, let's see, it was, you know what, I should have written it down. I've been dealing with these numbers all day. So it was over $2,000. So that was a great help. And Paige also exceeded her $20,000 by $25. So she was an awesome service coordinator. And if there are any other questions, I can address them.
All right, thank you, Michelle. If there are no other questions, we can move to vote. All in favor? Signify by saying aye or raising your hand. Looks like you guys are frozen for me. Veronica, did that pass?
Yes, it did.
Okay, thank you. Anyone need to oppose or abstain? If not, looks like the motion carries. Next, we have the 2020 budgetary adjustment, page 12. If I can get a motion for that discussion item.
I'll make that
So
motion.
moved. Second.
Natalie and Dave running pretty close there. So it looks like we can go ahead and discuss. Michelle, is that also you?
Yes. This is funding that came from United Way for fiscal year 21 to help with camps for children that are involved in service coordination. And this was a very generous donation, and we really appreciate it because our money that covers these camps and respite, wraparound, and things like that, it doesn't come immediately at the beginning of the fiscal year. And in the summertime is when kids typically need to be at camps, because when school starts, they can't. So we always have trouble getting kids to camps in July and August, sometimes even September, depends on when the funding actually comes through. But I just wanted to make sure that we had added this to our receipts and our expenses at the county level so that we can expend the funding. And we have, I believe, four kids going to camp already anticipated. So, or already, I think may have already gone. So thank you, Robin. We really appreciate it. And it's a great thing.
Great, thank you, Robin, again. So all in favor of approving this budgetary adjustment, please signify by saying aye or raising your hand. Right, is anybody opposed or anybody needing to abstain? Right, if not, it looks like the motion carries.
Nate, before we move on, I'm going to terminate myself here since I've done my job.
And that's not here, but thank you.
Is somebody upset? What-
We're gonna
Sorry, that's my dog. I didn't even realize I was not muted.
I thought someone was sorry to see me go. All right, bye-bye.
see you, Michelle, thank you.
You're welcome.
Can I add in quickly, we had an addition to the meeting just now of Lori Donnelly. Hi, Lori.
Hi,
And
everyone.
because she is not on video, we will need just to do a rolling roll call for each vote going forward here.
I can video up. No worries.
Sorry. Never
All
mind.
right.
We do not have to do a rolling roll call now.
All right, thank you. Good morning, Lori.
Morning.
Looks like next we move on to item number 3, Council Governing Board Business of the Day. Looks like we have bylaw revisions on pages 13 through 20. If I can get a motion for this item.
Make motion.
Thank you, Robin. Second.
I'll second.
Thank you, Lori. Right, Veronica, would this be you?
Oh, yes. Okay. I need you to go to page 15. The changes, it looks like there's a ton of changes and there's not. I forgot to tell Danielle when she was putting this in your packet how to get only the most current changes to show. So what I need you to look at is on page 15, officers of the governing board. This is number 5. We had talked in previous meetings that we really haven't had a secretary position filled for quite a while. And so we wanted to just add that this position would be filled by the council manager. In B, it's again just adding language that the secretary / council manager would review the meetings, and the secretary council manager would be responsible for the meeting agendas. And then in C, this had come up this summer that we haven't had an ad hoc committee in a long time to nominate, and we just wanted to change the language to place on the May governing board agenda the nominations instead of having an ad hoc committee. And then the final change that I'm asking you to review is on page 20, and it's taking out that that the bylaws can be amended by a majority vote of all the governing board members at any regular meeting of the council, and taking out the number and taking out called specifically for that purpose. So those are the, I guess, 4 changes I'm asking for in the bylaws.
Great, thank you, Veronica. Do we have any discussion or question on those changes?
And I guess right now, I think everybody knows this, but Danielle and I are sharing that council manager duties. So when you see secretary or council manager, one of us is doing the agendas. Typically we're doing them together, and one of us or both of us are working on the minutes and getting those each month.
Okay, thank you, Veronica. If there are no further questions or discussion, I'll move forward with a vote. All in favor signify by saying aye or raising your hand. All right, anyone opposed or needing to abstain? All right, if not, it looks like that motion carries as well. All right, next we have the Partners Memorandum of Understanding, pages 21 through 23 of your board packet. If I can get a motion.
I'll make the motion.
Thanks, Mandy. Second, please.
Second.
Second by Robin. All right, Veronica, I assume this is you as well.
It is. This is just something that it appears every 2 years. It's really just to identify the roles and responsibilities of our membership partners. There's a background section. I didn't change anything on here except for the dates. But I think there are new members that probably hadn't had a chance ever to maybe see this. So before we sent out signature pages, I just wanted to make sure that everyone was still good with the language and the terms. My plan is if this is approved, that I'll have Nate and Paige and myself do one signature page, and then I would email all of these out to all of the governing board members and ask them to sign and date and return their individual sign forms to me. And then I would save all that electronically.
Okay, thank you, Veronica. Are there any questions or discussion on the Memorandum of Understanding? All right, if not, all in favor signify by saying aye or raising your hand. All right, anyone opposed or abstain? All right, if not, that motion carries. Next, we have the 2020 through 2022 updated shared plan, pages 24 through 29. If I can get a motion for that item. Sue, thank you. Second, please. Like Lori. Natalie and Dave are tied again. All right, Veronica, we'll turn that over to you.
So our shared plan just has to be updated every year. We wrote this right after our strategic planning session. And so I've added updated language and data points to this. I have submitted it to the state, but it requires your approval in minutes for the state to ultimately finalize our shared plan for this year. I would look at most likely rewriting this plan. I think we'll have to start the rewrite next year. We had some, I don't know if you have any questions about anything, I'm happy to answer those. We had some good things happening before COVID hit. We had a lot of positive movement on our attendance. We had a great movement on our PAX tools training events. We had trained over 224 individuals, and we had attended 15 community events. Our community care team referrals were going well before COVID. And with some of the districts going back full-time, I would anticipate that we will see new referrals in the fall.
I just would also add that, you know, council has gone through significant changes over the past 6 months, especially. And as Veronica said, I think that this next year to 18 months is really a time for us to revisit our direction, council management, the role of council manager. We're kind of in a status quo, keep the boat afloat mode right now. But, you know, I think that the changes that have happened in council over the last 6 months really lead us to look at what is our mission. We don't have something necessarily that we're grabbing onto as a council to impact. There are some things, but there's not really a council-wide goal for a mission that will impact kids and families in the county. So I really think this next year is a time for us to revisit both the structure of council and what we as the membership want to do.
Thanks, Veronica and Natalie. And Veronica, just as a follow-up question, are the community care teams, are those meetings still taking place, or have they been on a bit of a hiatus with COVID?
I think last month we took off, but we have been meeting. We've been utilizing the time since we haven't had school district referrals to really just update one another as community agencies, as our service delivery has rapidly changed from week to week and month to month, just so that we're all on the same page about what one another's offering to families and children. So that's how we've been utilizing our time. Our next meeting is next Thursday.
Great, thank you, Veronica. Do we have any other questions on the shared plan update? All right, if not, I'll move forward with a vote. All in favor signify by saying aye or raising your hand. Anyone opposed or desiring to abstain? All right, if not, that motion carries. Next, item 4, looks like we have service coordination update. So Paige, we'll turn it over to you.
Okay, so service coordination has been staying busy. I have about 13 cases right now. A few of those are pretty low needs, and then I have a few who are pretty high need cases. So they're keeping me busy, and I'm continuing weekly check-ins with families, if not more. But for the most part, our families are doing pretty good. I wanted to update, we did turn in all our fiscal year 20 reports to the state, so those are all done and in. And then MSY, just wanted to update you guys. We had one youth who completed their stay at ALCO that we used MSY funding for. He stayed there for 120 days and then was able to return home. And then we have 2 youth who continue to receive additional funding for their residential placements. And we anticipate one of them coming home hopefully by the end of the year. And then we have one youth who was approved for MSY funding that we got to use a little bit, but her placement is not working. So we are working with the MSY team to figure out if we can hold that money until she transitions home, or if we're going to have to figure out another way to use that money. In total, Tuscarawas County has utilized about 212,000 from MSY money, and that has served 5 youth. And I looked on the Ohio Family and Children First website, and as of July of 2020, they've utilized about 6.5 million and have served 248 youth. So I do have a couple more MSY applications that we are working on currently. So we'll get those in as soon as we can and continue to utilize that money while it's available. But that's pretty much all that's going on with service coordination. So if anybody has any questions.
I will say the state is telling us that there will be MSY money for fiscal year 21. So it didn't appear that there were any major budgetary cuts to that funding. So we are just going to continue sending in MSY applications as the needs arise in our county for our kids.
Great, thanks. Any other questions for Paige? All right, if not, it looks like we have unfinished business, council manager vacancy. Natalie, would that be you?
I don't know that I really have much more to say than I said. We had set aside, we had requested at the last meeting for some funding to be set aside just for a small portion of Danielle and Veronica's salary. They've always helped with council, but with the position being vacant, they really are taking on the full duties of that council manager role between the two of them. You know, whenever we did this, we really thought we would be out of the pandemic and back to full-time work at this point and be able to start to draft a different plan. But I see this continuing because it's working, at least for a brief period of time until we come up with a different plan and decide what that position is going to look like.
Sorry, thanks, Natalie. Any questions for the group on that? Right, if not, it looks like new business. Just a reminder that our next meeting is September 10th at 10:30. Likely via Skype or Zoom, I imagine. Now, does anybody have any updates from your agency that you'd like to share with the group today?
I would just like to throw out there, you know, the money that United Way donated, this $6,300 was from our COVID Community Response Fund. And it was through discussion, I think, with Nate and Natalie, got started with Veronica. The community's been very generous. The United Way has agreed to match dollar for dollar all the community donations. We have distributed over $38,000 so far, and we realize it's going to be a long-term issue. But I did want to throw it out to the group. If you have any, we're giving money to organizations that help people, that give it to the residents of Tuscarawas County, whether it's food or housing or education. However, if you think of anything, please let me know. Just contact me because this money's out there. The donors want it utilized in Tuscarawas County, and we want to make sure it gets out there. So if there's any kind of program that has been impacted by COVID-19, which probably everybody has, but you might need some assistance that could help the residents of Tuscarawas County, let me know. Just contact me and we'll see if we can assist.
Thank you, Robin. That's great news. Anybody else?
I did just want to toss this out to the group, not necessarily children related, but we were ramping up at the beginning of COVID for what we had expected to be an increase in suicides based on historical pandemic data. What we've seen is a significant increase in overdoses and overdose deaths in Tuscarawas County, specifically happening in New Philly, solely because that's where a lot of the transfer happens of the drugs, and there are hotels right down near places where the drugs are being purchased. The Opiate Task Force is meeting frequently. We have a rollout community awareness plan that we're working on again tomorrow. The reason I'm bringing this up to the group is the behavioral health system keeps discussing and preparing for a surge in mental health issues, surge in addiction issues. I'm going to ask, we're going to have podcasts that we're doing. We have Facebook posts that we're doing. We have resource lists, virtual group lists. So anytime we post something like that, I'm going to ask Veronica to send it out to the groups that are coalitions that we're a part of, like Family and Children First Council, Anti-Drug Coalition, Opiate Task Force. If you would please consider posting to your business Facebook page, as well as potentially your personal Facebook page, the reach that we can get when we're hitting the community with both of those options is so much significantly higher than when we just do it on our Adams page. So no pressure, but if you're willing to do that, the goal really is just to reach as many of our Tusk and Carroll residents as possible.
Great, thanks, Natalie. Just quickly, a few updates from Board of DD. We're currently going through a bit of a brainstorming process with an outside consultant. We're trying to figure out what do we do with some of the kids who are intensive needs who won't be in school full time this year. It's not as simple as finding a traditional babysitter to take care of those children. It's a need that we're assuming will happen here in the next few months. So we're trying to pull together some resources and Paige, Veronica, Natalie, I'm sure we'll pull some of you guys in at some point just to kind of help us to brainstorm what could we possibly do to help these parents out as they kind of deal with the hybrid model of schooling this year. And then I also just wanted to throw out to the group, there's a conference coming up in September completely online. It's the National Association of Dually Diagnosed Individuals, so individuals with mental health issues and also developmental disabilities. Natalie and I in the past have helped with the planning for that. It'll be September 14th through the 16th, and you can choose which sessions you would like to join, but it's typically been a good conference that has some very pertinent information. And Veronica, I can share the link for that out to the group as well. That's all I have. Anybody else? Anything pertinent to share today?
We were back working at the office pretty much the whole month of July. And then I was on vacation last week and came back to a call from the health department because somebody that is at our center quite frequently had tested positive for COVID. They're healthy, they're okay. They're now out of isolation, but so I'm back working from home for a while. I'm out of quarantine. Actually, yesterday I was out of quarantine, but we've had the whole center disinfected and everything. But unfortunately, I don't know how far this went because I know they had clients that had to be quarantined. And right before I left for vacation, we had Homeland Security, FBI, and ICE agents at our office doing interviews. So it was pretty widespread of who could have been reached by this. But so hopefully everybody's okay and healthy because they were from out of state, actually, all the agents. So I don't know what all happened with them, but everything has been disinfected. And so if anybody needs anything and doesn't get me right away from email, I think most of you have my personal cell. If you just use that, that'll be the fastest way because I'm maybe back and forth between home and the center. So.
All right, thanks, Mandy. What a strange new reality we're all living in, for sure. If there's nothing else from the group, I can take a motion to adjourn at this time. All right, thank you, Lori. Guys, it was nice to see you. Hopefully we'll see each other in person before 2030. We'll see you guys next time.
Stay safe.